For decades, this is what MOACIR ZINI lived with, LEISHMANIASIS, a parasitic disease that caused lesions to sprout all over his body. Now he's free of those lesions. He came to Rio de Janeiro to a global conference on neglected diseases to try and help others.
I had this for 26 years, waiting for a new drug that works. People haven't faced the discrimination that I have. When I go out for lunch or coffee or ice cream with my kids, people would look at me. I don't want people to go through what I did.
MOACIR almost died when taking the medicines that were first prescribed him by doctors. Like many medicines for these diseases, they're old and outdated. In September, the Drugs for Neglected Diseases initiative got him access to a medicine that wasn't licensed in Brazil. It cleared up his symptoms in 5 days. He joined doctors and experts and other people who suffer from neglected diseases at this conference. Fellow attendee MAIRA Gutierrez has Chagas, a disease that around 7 million people, mainly in Latin America, have. It can lead to heart failure.
Everywhere I go, they offer me to run for cancer, run for diabetes, run for this. And I'm like, well, they already have enough money. Why don't they try to run for Chagas?
According to the World Health Organization, neglected diseases affect 1 billion people worldwide, mainly the poor. Latin America, where 1/3 of people live in poverty, is particularly affected.
The people who are mostly affected by those diseases, they're oftentimes excluded or vulnerable or live in remote areas. So I tend to say that neglected diseases are the physical representation of social exclusion or vulnerability.
Only 4% of new drugs and vaccines in the millennium's first decade were for neglected diseases. MOACIR and patients like him are fighting to change that. Raney, Jazeera, Rio de Janeiro.